And I don't think it's any stretch to say that the CDC, the Center for Disease Control, was not ready for this. But were they really set up for this in the first place? And if they weren't, was that just because of the way the parameters were set up for the CDC and they were simply operating inside those parameters, or did somebody drop the ball? Standing by on the AcuteHearingCenters.com hotline is Dr. Murray Cohen. He is president of Consultants in Disease and Injury Control, CDIC. It's based in Atlanta, but he worked for many years for the CDC, also based in Atlanta. I had Dr. Cohen on with me on Saturday. We were cut short because we had to get to the president's news conference that fell at that same hour. But he's back with me tonight to talk more about where we are right now as a society here inside the borders of the United States. Let's go to Dr. Cohen right now. Dr. Murray Cohen, thank you for joining us. We appreciate it.
Thank you for having me back, Ken. It's always good to talk with you.
So we had a little visit on Saturday before the president held his news conference, and a lot has transpired since Saturday, since you and I had a chance to visit. Now it seems like the concern level in just those few hours has gone up. They're saying no gatherings or recommending no gatherings of 10 or more people. And pretty much here in Ohio, this state is in a lockdown. The primary's been delayed. Restaurant and bars have been closed. You can only get takeout. So I'm wondering, do you sense more of a sense of urgency since when we last had a visit on Saturday?
Absolutely. And I think it's simply the government as well as the population getting a more realistic sense of exactly what we're up against. I think there was, for whatever reason, there was a downplaying or not seriously enough, thinking seriously enough about this particular virus. And what we've learned is that this virus is the real deal. And we are in a very real national emergency, as the president has declared. And things are bad, and they're about to get very much worse. So all of these actions are responding to that new reality, new understanding.
Yeah, let's visit just a little bit about that. You're right. I don't think a lot of people heeded the words that were issued and the warnings that were issued over the weekend. And now I think everybody's antenna is up. What will this quote-unquote social distancing, this shutdown of communal places do? I mean, do you believe it will have the tangible effect that everyone is looking for if everybody adheres to this?
It better. We really have to. And a lot of the reason I hedge a little bit by saying it better, and I can't say for sure, is we're still learning a lot about this new virus, including exactly how it is transmitted. We know that it is very easily communicable, meaning that for someone to get exposed, the likelihood of them actually getting infected is a real high probability.
Yeah.
We also know that this virus, we talk about social distancing because of coughing or sneezing and the particles traveling, for a certain number of feet away from the patient. But the reality is this virus is replicating in the nasal cavities and in the throat and mouth of people who are exposed, even if they're not infected, before they get infected, which means they're shedding virus simply by exhaling, by breathing.
And these spores, these particulates, how far can they travel? Do they have a distance, or does it depend upon the enormity of the sneeze or the cough?
It's the latter. They don't sprout wings. They can't move on their own. It's simply the amount of force behind whatever expels them that gives them any distance at all.
Yeah.
They are, relative to other particulate in the air, really big, soggy raisins. They're slow, they're heavy, so they're going to fall out of the air pretty quickly. They're not going to float around a lot like an influenza aerosol would.
Sure. You and I visited on Saturday about the CDC, and the CDC seemed to be caught flat-footed with all of this. But the CDC was not; it just wasn't set up for this kind of thing, was it? I mean, the Centers for Disease Control just the way its inception and the way it's run, it's a big, lumbering, red tape government giant, and it's just not set up for swift movement, is it?
Well, it is definitely that big lumbering giant that you mentioned, but its mission very specifically is to be the nation's prevention agency. They have the very specific responsibility, authority, and frankly, budget for preparedness. They just weren't ready. I don't know what else you call it. It's not competent. It's not what the taxpayers deserve and are paying for. And it's inexcusable to my mind.
Well, we saw on Capitol Hill last week, its director, Mr. Redfield, he was a font of uninformation. He just didn't have anything to offer. And I'm just wondering, is it so politicized there at the CDC to a point where it's basically just a government bureaucracy, particularly at the top? Or is he just someone that isn't qualified to have that job?
Well, I don't know Dr. Redfield personally. I do know his record, and we actually crossed paths, back to the late 80s, when we were both involved in the HIV/AIDS program, me at CDC and he at the U.S. Army. So he's got the credentials, the qualifications, and the experience. It's pretty clear, though, that at this particular time, with this particular instance, he's just not up to the task. Now, him personally, I don't know. I don't know his management style. I don't know how they're running things at the CDC. I haven't been there in 20 years. Yeah. But I know that we all should be expecting better. And going back to President Harry Truman, where does the buck stop?
Yeah.
He's the guy at the top. So, wherever else down the chain things slipped, somebody needs to be accountable. Of course, there's plenty of time for finger pointing later. But I'm very much afraid of the medical system being overwhelmed. There's a lot of elements to this. I don't know how much you've talked about it on the show or how aware your listeners are, but simply things like medical supplies, hospital supplies, IV bags, syringes, needles, the basic, everyday run-of-the-mill operations of a hospital. Much of that manufacturing has been outsourced to China and India, and those supply chains are shut down now.
Yeah.
So what's going to happen when we have shortages? We're already having shortages of protective, equipment such as masks and gloves. And I don't mean to run on the drugstores for that, but in the medical supply industry.
Well, from the way from the way it's been explained, is if a doctor or a nurse practitioner or whomever applies this coronavirus test, they have to be dressed out in hazmat. And then after the test is administered to a patient and that test goes off and the next patient comes in for that test, they have to redress in different gear. So this again plays into your supply chain thing and just how laborious this testing system is.
It's because the virus is so communicable. So, yes, indeed. Anytime you're treating a patient, it's no different than all along when your doctor or your dentist, needs to wash their hands in between seeing patients.
Yeah.
Now they just have to be, you don't want to end up getting, being a carrier of infectious particles from a patient to the next patient who otherwise wasn't infected. So, the healthcare providers have to be the solution, not the problem.
Yeah, Dr. Murray Cohen is our guest. He has worked with the CDC. Left there, as he mentioned, several years ago. President of Consultants in Disease and Injury Control Incorporated. It's an Atlanta-based corporation. Listen, Doctor, this the great thing here, the overarching thing is the unknown. We just don't know. I mean, we could be so far ahead of that curve that all of this is becoming a model on how to deal with it. We could be so far behind the curve. We could be what Italy has become. We don't know, because it hasn't played out yet, and it is an unknown malady that we're dealing with here. So I suppose the question is, how much is this being made up on the run? How much are they just, ad-libbing and just trying to figure it out as they go?
Well, we have had a system in place. As you mentioned at the top, it was dismantled over the last couple of years. But the system was in place. The basic training was there. Really going back to, if you'll recall, the anthrax and the male bioterrorism in 2001, 2002. and then revved up again as we prepared for Ebola outbreak just 5 years ago or so. So hospitals have put together plans for crisis management for a biological episode, whether it's an epidemic or a bioweapon. There are drills that they do. There's a taxonomy of response and incident command and all of that sort of thing that has been in place. Now, a lot of hospitals are needing to dust it off now. It's been gotten a little bit lazy, but they have them. So we're not starting from scratch. We have those, and we have been pretty good at it. On an individual hospital basis, I think preparedness is probably pretty good. On a coordination at the national level, it's been lacking. Coordination on a regional level is spotty. I give much credit to the local level and local governments who have been the best responders so far. And at the end of the day, they're on the front line no matter what happens from the top down. It's very scary. And, another scary element, too, is one of the problems that happened in China is a lot of the healthcare providers were among the first ones infected, and who died.
Yeah. Yeah.
We can't replace our doctors and nurses quickly.
No,
we've got to be protecting them.
This is, you're the doctor, I'm the patient. There's this anecdote that's making its way around that what we should really be praying for, besides the fact that this doesn't hit us as strongly as it's rumored to be coming, pray for warm weather. Pray for hot, humid weather, which is in great supply here in the city and the area of Cincinnati during the summertime. Is there truth to that, or is that just urban myth?
Well, it's in between. To the extent that this virus will present itself seasonally, like influenza does, it's pretty likely, but for a lot of reasons, flu really does kind of disappear in the off season. COVID-19 is not going to disappear. You can take that to the bank. First of all, it's only starting to peak now. So even if, next season or season after next, it presents itself seasonally, right now it's getting started. Yeah. So it's a wildfire that still has an awful lot of underbrush to burn off. So no, you can't sit and wait for baseball season and then say, fine, we don't have to worry about it anymore. Not this time. Yeah. Hopefully by next year.
He is Dr. Murray Cohen. And Doctor, thank you so much for your time and for providing clarity to a lot of this. It's confusing for us. It sounds like we need more people out front like you. Thank you so much for your time. We appreciate it.
Thank you, Ken, and thank you and the media for doing a great job that you're doing in informing the public, keeping panic down.